It's become one of the most scrutinized aspects of a doctor's visit or post-op recovery when to prescribe opioids. A new state law now safeguarding patients.
But it comes as one local doctor is under fire, faced with allegations he prescribed opioids with gross negligence. 23 ABC's Josh Sanders has more on the allegations and what's being done to protect other patients. Josh?
Yeah, Tim, Jess, that new state law is requiring California doctors to prescribe the overdose drug Naloxone to counter the effects of an opioid overdose. And with opioid addiction numbers on the rise in Kern County, we're now hearing about one local doctor facing accusations of gross negligence and overprescribing opioids.
A new state law is requiring doctors to prescribe an opioid overdose reversal drug called Naloxone to patients at high risk for developing an addiction to opioids.
If someone who goes in and has a minor procedure and gets 10 Vicodin or something like that, that's not what we're doing. What we're looking at is people who are on really high doses.
The opioid crisis is growing throughout the country. In October of 2017, President Trump declaring a national public health emergency.
The opioid crisis has replaced the American dream with the nightmare of addiction. A terrible, terrible situation.
Kern County seeing the effects as well. In 2016, there were 54 opioid overdose deaths. And according to the California Department of Public Health, that number growing to 75 deaths in 2017.
Police officers, firefighters carry this with them, and it can be administered by practically anyone.
According to Kern County Public Health, Naloxone has been administered 331 times from July 2017 to June 2018. And KCSO says they've used the drug 5 times since February 2016. With the growing number of opioid prescriptions, attention is being given to the doctors prescribing the medications. Monday, 23 ABC learned the state medical board is investigating a Delano doctor, Sadeh Salmasi, for excessively prescribing opioids, methadone, and other medications to a woman whose August 2013 death was ruled an overdose. The 16-page accusation says she received those prescriptions for problems such as frequent pain and post-traumatic stress disorder. Documents also showing that Dr. Salmasi was aware of the patient's alcohol use, refilling her prescription at least once a month from 2012 to 2013. As for the new law, Assemblymember Jim Woods says he hopes doctors take the time to educate their patients on the dangers of opioid addiction.
What I don't want to see is that that doctors just prescribe both of these and don't do the education part, because the education part is absolutely critical. Just giving people 2 prescriptions and sending them on their way is not what we're intending to do. It's just we want to make sure that the highest risk people are protected.
Now, guys, those opioid overdose-related deaths, staggering numbers. Since 2000, the White House has said over 300,000 deaths related to opioids. So they're hoping this new drug will help reduce those numbers. As it comes to prescriptions that were written, well, state public health says in Kern County alone, 650,000 prescriptions last year, 2017.
You hear that number. You looked into how that number compares to other counties near us.
Yeah, you look at you look at Fresno County. Fresno County, 700,000 prescriptions written. So we're right there, and Fresno is just a little bit bigger than we are.
And what is the doctor saying about the accusations that are against him right now?
Yeah, we reached out to the doctor. A spokesperson through his office said not willing to talk about that right now. He has asked for a panel review. If found guilty of these accusations, could risk losing his license or even some lesser penalties.
All right, Josh, thanks
Certainly
for that.
Something a lot of people are talking about. Josh, thanks for that. The government shutdown, we'll move that.